Sometimes the wake up call comes through pain, the kind that you can't push past, stretch out, or numb away. For some people, it's the only thing that makes them stop and listen. Today, we're talking about Ellie's story. A woman who came in with severe lower back pain was told that she would need surgery and ended up discovering so much more than physical healing. Welcome to Healing Beyond the Symptoms, the podcast that helps people discover the root causes of their health struggles and take back control with science, strategy, and self-awareness. I'm Dr. Leah Hahn, a chiropractor and functional wellness doctor who believes that true healing starts beneath the surface. So let's dive in. Welcome to Healing Beyond the Symptoms. I'm here with Dr. Scott Hahn, a chiropractor, nervous system expert, and my colleague at Body and Balance Wellness Center in Golden, Colorado. Together, we help people uncover the deeper meaning behind what their bodies are trying to say. And Ellie's story is such a powerful example of that. Scott, you worked closely with Ellie, and I know this story really stuck with you. She was in a ton of pain, but it turned out the real issue wasn't just her back. So tell me more about it. What do you remember when Ellie first came in?
I think the biggest thing that I remember from Ellie was just the severity of the low back pain that was going on down there. It was it was the only thing that she could really focus on. It was just crippling, debilitating.
Do you know of anything else that she had tried to deal with that lower back pain?
I mean, she was taking your ibuprofen, your Tylenol, your muscle relaxers, had done a lot of massage, she tried acupuncture, and just the system was just not letting go of that pain. And it was just continuing to increase and increase. And she worked on her feet. She did people's hair. And so that was one where it was becoming more difficult for her to even do her job anymore. And she was having to take time off and rescheduling clients. So it was interfering with her life. So she had to tried to figure out what was going on.
And I remember in this story because we had actually worked with her husband for quite a while, and he had been encouraging her to come in for a long time, and she was pretty resistant at that point. Do you remember what her energy and her mood was like? Like, what are the things that you noticed right away about her?
I think, the other thing that stands out to me too is just she was really hesitant to come in because what we do is so gentle and she didn't think it would work. And so I do remember that was probably, her biggest hang up of like, well, how is this going to do anything? They're not going to manipulate me. They're not going to push on this. They're not going to change anything.
Not going to twist and crack
No,
me.
there's not going to twist. There's no popping. There's no cracking. So how can that do anything? I think that was, one of the other biggest things that stood out. So in addition to that, what I noticed within her energy and her mood was that one, she was getting more and more depressed because I think there was a lot of fear in her thinking that this is the way the rest of my life is going to be. I'm going to have to give up my career. I'm going to have to give up, my job. I'm going to have to give up my clients in order to be able to deal with this chronic back pain or chronic low back pain in that sense. And she was very worried about that component.
I remember too, like she, had been an athlete. I believe she played volleyball. And so she was a pretty active person as well. And so just being able to exercise and just, take care of her body had become more challenging as well. So if you think of like, what was her basic life like at this time? How would you describe that?
I think it was pretty much the whole focus was the low back pain because that's the only thing she could do. She couldn't really work. She was kind of stuck at home. She wasn't able to exercise anymore. She was trying to do some yoga to try to support with the stretching, but that seemed to only make things worse. So she was really just kind of finally, stuck where there's nothing else that she, thought she could do, which then she finally just said, okay, let me come in and let me see if these guys can help us or help me.
So I remember that she had been a hairstylist for many years. And so she had, long hours and she was standing on her feet, but her body was clearly saying enough, like this is not working for me anymore. So you've often said before that pain can show up when the body can't adapt any longer. Was that what you saw with Ellie?
So what I saw with Ellie is that there was so much tension in the low back and the body, the positions that she was putting herself in repeatedly over and over and over again. And because things were locked up, it was driving this pattern deeper and deeper and deeper into her system. So it wasn't a matter of, is this, the tension was causing the problems, but the tension wasn't the origin of the problems. The origin of the problem was a lot of this past trauma that she had been holding on to for years.
So let's talk about this, the point in which the body stops that compensation process. How does chronic physical stress blend with what's happening with the emotional or the mental stress in someone's life?
So a lot of times what will happen is we hold these different physiologies, these different protections. So as our body starts to tighten up to protect ourselves, different areas will get locked up based off what that tension, what that underlying emotion is that's driving that. For some people, it's their upper back. Some people, it's their neck. Some people, it's their, base of their skull. Sometimes, a lot of times it can be like lower back for different individuals. So more commonly, there was a study where they looked at people who have chronic pain and they tried to figure out what was the number one predictor as far as how could we predict if someone was in pain? And the number one predictor wasn't how big the bone spur was, how big the disc herniation was, how much trauma was necessarily in the area. The number one predictor was the psychosocial factors, which were, what is my, do I have job satisfaction? What's my home life like? It's the underlying mental emotional stress that we're holding and carrying. And then when that's present, that is the number one predictor, is if we're in pain, not structurally what's actually going on.
And we see that all the time. And the other piece that we really look at is that there's been several different pieces of research that have showed that the amount of flexibility in the spine has so much correlation with someone's ability to feel positive emotion. So if they have stuckness in the spine, so if like areas aren't able to move, they're more likely to feel fear or anger or depression. Where if they have a lot of movement, healthy movement and flexibility within their spine, they're much more likely to feel joy and happiness and peace and a sense of well-being. So those are clinical things that we see on an everyday basis. How can someone be strong their whole life and then suddenly just everything falls apart?
I think the typical thing that happens there is when people see that or they experience that, is they've missed all the different pieces that have led up to that moment.
Mm-hmm.
The proverbial person who bends over to pick up the pencil and their back goes out. Bending over to pick up the pencil isn't what caused your back to go out. It was the years and years that led up to that situation. It was the final straw that broke the camel's back.
Mm-hmm.
So in that scenario, it's one where it's like we got to start taking a look at like what were all the different pieces that led into that? What was happening? Where was the dysfunction? Why, where was the mental emotional stress that my body was holding and trapping this tension pattern into my body? And then that is going to increase that wear and tear on that specific area. So in Ellie's case, there was a lot of old kind of family trauma that she was holding on to. Her body, stuff with her sister, stuff with her dad. And all of that was just kind of getting locked deeper and deeper and deeper into her system. And so she kept this really intense, like stress pattern trying to protect and
Guarding,
and
yeah.
guarding around that. And it wasn't until that she was able to kind of release kind of the old tension pattern, that's where then the underlying structural challenge that she was dealing with started to heal then.
Sure. So again, like, you kind of creating safety in the nervous system. And once you create that baseline of safety, then allowing things to start to heal and reorganize and repattern. So it wasn't like her body was broken. It was that she needed to be repatterned. She had been living out of that pattern for a long time until it was like enough. And then again, reclaiming safety and then going into repatterning can make a huge difference. What was Ellie's system trying to tell her through all of that pain?
So what Ellie's system was trying to tell her through the pain was that her, the challenges within her family, and I should say her extended family, even though they're close, which is close relatives and, dad and sister, is that needed to heal in order for her to be whole.
I think a lot of people can relate to this situation because we're taught to push through the pain and we stay in survival mode because you just have to show up. You're trying to show up, you're trying to perform within your life or show up for your family, be there for your career. But the body will eventually call a timeout for you, especially when there's been that extended trauma that really hasn't ever been dealt with. And so that was so the case in this story. At what point did you start to see Ellie's whole situation start to shift? And when that healing started to become more than just physical relief that was happening for her?
So one of the things that we work with is we call it the respiratory wave, which is the breath wave, which is
Hmm.
getting the breath through the area of the pain, through the area of the tension. And
What do you see when that with that breath wave in an area of chronic tension? What happens with breath in an area of chronic pain?
so what you want to see is you want to see the breath go through each individual segment or each individual vertebrae within the spine, within the body as it's breathing. So
Hmm.
anywhere where it might be stuck or trapped, you'll see maybe the region move as a whole and it can get through there, but it's not integrating these there's other underlying tensions and traumas and stuff like that. For her, she couldn't access it at all.
I just remember there was like no
It
breath.
was just
There's
flat.
no breath at
Yeah.
all.
There was
Yeah.
really, really high tension in the area and it just didn't want to move at all. So the first thing that I observed was the breath started to be able to access that area. As the breath started to access that area, she started to notice the pain was decreasing, but she was also becoming aware of that she needed to heal the relationship with her sister and she needed to heal the relationship with her dad.
So you saw like so first thing like breath completely shut off, especially in the area where there was pain. And then you started to do the consistency of the adjustments. And then you can start to see breath move into that area. And with that breath moving into the area, then what we know clinically is that there's safety being created within the nervous system. But then at that point, she was making those connections of what she actually needed to address on a more emotional level as well.
Yes.
Awesome. What else did you see change once she started network care, nervous system based care?
I think the other biggest thing that I saw was that she felt more self-empowered
Mm-hmm.
to know like I'm okay, I got this, I can get through this. I have trust in my body again,
Mm-hmm.
and trusting within her body as she started to let that go meant that she didn't have to give up her career. She can continue to do the things that she loved. I also saw how her relationship with her husband started to change because what ended up happening is she stopped living out of fear and stopped worrying about the different things that she'd held on to for years. Their relationship started to bloom. Their relationship started to grow even more. Even though they were married and they were happy, there was just lacking depth. And this really helped build that depth that they were both wanting, needing, and deserving.
Awesome. What did she realize about how her stress and her identity and her pain were all interconnected?
Other than just to waiting for that moment of this is going to fall apart because
Mhm.
that's what she's been programmed to. That's what she's been, taught herself to believe because that's what's happened in her past. Now she was able to step into the relationship, step into the job without that fear, not worried about what's not going to happen. And then she could actually focus on what she wanted to build and grow towards.
It's amazing is how her body started to heal, how she could actually see herself differently, how that sense of identity was really strengthened as she was so much more connected to who she really was and created a life that was more congruent for who she really was. What did she start to say about her purpose or her role as just a wife and a business owner, a partner, as she got stronger?
She talked about how much more fulfilling everything was.
Hmm.
She didn't, hate going into work anymore. She didn't dread going home. She actually wanted to go to work. She wanted to build the relationships with the clients. She wanted to be able to get home to build that relationship with her husband more. She started to look forward to things in life, knowing that she was being fulfilled and knowing that she was in control and she could create the change. And it wasn't about fear. It was really about creating the best life that she could.
And we see that so often with clients is how they start to engage in their lives. Like when you start to heal and you start to have a better sense of well being, you're making better decisions for yourself, and you see them actually engage in what they want and engage in making changes that are going to be healthier for them, which is really exciting to see. How do you help patients shift from I just want the pain gone to I want to actually understand what's here?
So most of the time, it's when people start to feel the shift in their system.
Hmm.
The pain starts to dissipate, and maybe they maybe started care based off of a leap of faith because of, They couldn't understand how the low force would do anything, but they had a friend or a family member telling them, just stick with it, just continue through. And once this shift starts to change and they go from this thinking of there's no way that this can work to I don't understand how this works, that's where they want to start to learn more. Because that is, as they start to understand and feel the change, they're excited to tell other people. They're excited to tell their friends and family members. And a lot of times even before that, before they even want to, people are noticing it within themselves, or they're noticing it's like, wow, there's something different about you. What is that? And they don't have words for that. So they want to try to be able to explain it to them in the best way that they can. And that's where a lot of that curiosity starts to build and grow, and wanting them to help them to understand more.
What do you think the deeper opportunity is when pain finally gets someone's attention? What is that deeper opportunity that they can actually achieve?
To me, it's always about growth. It's always about, what is this trying to tell me? What can I learn from this scenario? Because we could always keep thinking, poor me, poor this, poor that. We can always go down that path. But to me, every situation, even in life, whether maybe things didn't go our way, guess what? We can still learn from that. There's still takeaways that we can gain. So if it's all negative, if we can find some level of something positive to take away from that, something that we can grow from, then there isn't loss in that. Then we can keep building and keep becoming a better version of ourselves. And the better version we are is how we can show up different in the world. And as we start to change ourselves, the world can start to change as well.
Exactly. What does true resilience look like in Ellie's story?
Well, in Ellie's story, it was just about adaptability and really healing the bonds within her family and healing those strained relationships or lost relationships and rebuilding them back into something that can be healthy, something that can be positive, and something that can be supportive. To me, resiliency has a lot to do with adaptability and just being able to understand that things don't need to be forced. They can be fluid. They can look different than the way that maybe we thought they did. And that doesn't mean it's wrong. It can be just as healthy, and we can take, just as much away from those changes and that growth, which then allows us to have the space to show up as ourselves.
I love that. It's the idea that healing isn't just about going back to who you were before the pain actually started, but becoming stronger and being more connected to the growth and to that other side. Scott, for someone who's listening, who's in the same place, maybe they're in pain, maybe they're scared about what comes next, what encouragement would you offer?
I think the encouragement is that almost any scenario that there is, someone else has been there and someone else has healed and someone else has made their life better. So if we know that that's possible, then we can let go of the fear that it's not possible. And when we step into potential versus fear and lack, that is where the change can actually happen.
Exactly. How can they start shifting from fear to curiosity about what their body is actually telling them?
The simplest thing for them to do is find safety within the system. So finding safety can be maybe in the subtlety of the breath. Where does my body not hurt? Trying to find what is working right rather than just focusing on what's not working right or what's working wrong. So if we can focus on what's right versus what's wrong, then we can start to build that momentum into that growth mindset, into that safety mindset, into where do we want to get to versus where am I just trying to avoid.
Ellie's story reminds us that our body doesn't betray us. It wakes us up. It's giving us a message. It's telling us something. And sometimes the very thing we fear, the breakdown or the setback or the pain, becomes our doorway to healing and to finding our greater purpose. If this conversation spoke to you, stay with us for more stories like Ellie's. Stories that remind us that healing goes far beyond the symptoms. Take a deep breath, stay curious with your body, and subscribe to the podcast so you don't miss what's next on Healing Beyond the Symptoms. Thanks again for joining me today on Healing Beyond the Symptoms. If you've been curious about network spinal, or if you've tried everything else and still feel stuck, I want you to know this. Your body is not broken. it's patterned, and those patterns can change. If you're ready to experience how gentle care can lead to profound transformation, I'd love to invite you to book a wellness consultation at bodyandbalancechiropractic.com. Together, we'll look at what your body needs to finally release, reset, and thrive. Until next time, breathe deep, trust your body, and remember, gentle can be powerful.